Today we are going to start new domain, that is gastrointestinal physiology. And today is the first competency number 4.1. And competency number 4.1 says, what is this area for competency 1? Describe the functional anatomy of digestive system. It means, functional anatomy means, in anatomy class you will be learning the anatomy of gastrointestinal system. Here we will discuss the functional aspects of this. Okay, some modifications, some particularly according to the functions, you will be there is some changes in the structures to adjust the functions. So what are these adjustments made anatomically for performing those functions we will be noticing. Okay, so this is the topic. To study the functional anatomy of digestive system, you should cover the following points. What are these points? Overview of the digestive system. First, what is digestive system? Where it is for? Digestive system means it is a system by which we make complex nutrients, complex food, edible foods into simpler one. That is absorbable, so that they become absorbable from the lumen of the GI tract into the blood. So, main function is to convert the complex food into simpler products, like carbohydrate is a complex product. So, complex organic substance. So, by the process of digestion, we'll convert it into, the system will convert it into simple carbohydrate, means glucose or fructose. So this sort of conversion will be made by the digestive system. And again, protein. These are also complex organic compounds. So as such, they are not absorbable. Their molecule is big. So they should be simplified. So this is done by our digestive system. While it will be passing from mouth to the different parts, this will be digested and then they will be absorbed. And the undigested part will be eliminated from the body through the process of purification. So, main purpose is breaking down of food. Main purpose is breaking down of food, and the second breaking down of food means converting the complex food into simpler one. And the next function is absorption of the digested foods. And the third main function is elimination of undigested food in the form of feces, stool. Okay, so there will be some major divisions in the system. So what are these? There will be digestive tract and some accessory organs. They will be supporting digestion. So what is that tract? It starts from mouth, then it is pharynx, then esophagus, then stomach, then small intestine. It has three parts. First part is duodenum, second part is jejunum, and the last part of is ileum, and then large intestine. So it will be having cecum, the ascending colon, transverse colon, descending colon, sigmoid colon, rectum, anus. Okay, and what will be the accessory organs? Starting from here, glands, salivary gland, then pancreas, liver and gallbladder. Okay, so these are the supporting organs, accessory organs. So let's see in short what are the functions of each of the tract is part of the tract and the accessory organs. The mouth, there is teeth. What do we do with the teeth? We masticate. We masticate the food, we break the food, big food particles, we break into smaller particles with teeth. Okay. Then, what we do? With tongue. Are there any function of tongue? The mouth and the tongue helps in mixing salivary juice with the food. Okay. Then it allows to swallow the food. Beside, there are some taste buds, and by tasting, it secretes through the tasting, smelling, seeing, salivary secretion. Before we take food in our mouth, salivary secretion starts. When you get the smell, the salivary secretion starts before that. Before ingestion of food, secretion starts before eat. Okay. So, when food will be masticated, food will be masticated here, it will be also mixed with salivary juice. And it is having, salivary juice is having a lot of fluid in it. Daily, we are secreting nearly 6.5 liters of fluid through all the secretions. Digestive, salivary secretion, secretion from stomach, secretions from pancreatic juice, secretions from intestinal juice. Bile. So all this secretion will contribute to about 8.5 liters of water. They will produce 7 liters approximately. They will secrete 7 liters of water. Moreover, we drink about 1.5 liter. Total how much came? 8.5. So out of this 1.5 liter we pass through urine. So how much secreted? Net how much? 7.5. So 7.5 secreted, 7.5 is absorbed. So almost equal amount is absorbed. The amount we drink, that amount is passing through urine and through sweat. Okay. And so tongue, what it does, assist in food manipulation and swallowing. Houses taste bud. So taste buds actually helps in stimulation of salivary juice. Next part is pharynx. What would be the function of the pharynx? It will send the bolus, food bolus to the next part. That is, it will send it, pass it, transfer it to the next part, that is into esophagus. So in esophagus, there is no secretion. There is no secretion from esophagus, and there is no such glands. Only it will be transferring the food to the stomach. Okay. So there will be some peristaltic movement. Because of this peristaltic movement, food will be sending to the stomach. So this is the function of the esophagus. Let's see what is the function of stomach. So stomach has 3 parts. We can divide the body, divide the stomach into 3 regions. What are these? Fundus, body, and okay. Then what is its function? Churning of food. So there are on the surface, on the wall of the stomach, there are how many layers? How many layers? Throughout the GI tract, you will find how many layers? What are these? outer serosa, then muscular coat, then submucous, then mucus. Then how many layers came? 4. Okay. So in the muscular coat for stomach, there will be longitudinal muscle fiber. Longitudinal muscle fiber. So contraction of these fibers will shorten the length of the stomach. And there is circularly arranged smooth muscles. So contraction of these smooth muscles will cause contraction, narrowing of the lumen of the stomach. So what is happening? This way contraction, this way contraction. There are some oblique muscles also. So with this, with the help of this contraction, relaxation of the stomach, peristaltic movement, the food will be churned. And this will be, during this churning, mixing, breaking, the food will be mixed with gastric juice. And some amount of salivary juice will be coming through food into the stomach. And this salivary juice contains enzyme. What is the name of this enzyme? Salivary amylase or ptyalin. Okay. So when it comes to stomach, the environment is different because of secretion of hydrochloric acid. So in presence of hydrochloric acid, acidic medium, this enzyme cannot act. So immediately, initially it will start working, but after that it will lose its activity. Okay, from the wall of the stomach, some secretions will be coming to the lumen. What are these? Hydrochloric acid and other gastric juice that will be containing what? Pepsinogen. So when initial secretion comes, so there will be presence of pepsinogen. But this pepsinogen is inactive. So it must be activated. It must be activated. So who will activate it? Hydrochloric acid, initially by the hydrochloric acid. Once pepsin is formed from pepsinogen, now this pepsin will convert other pepsinogen into pepsin. So this is the cyclical process of activation. So now this pepsin will digest. What it will digest? Protein. It will digest protein into peptones, peptides. Okay, not completely, protein will not be oxidized. Partly this will be oxidized here. Okay, so here in the stomach, juice of the stomach, gastric juice, there is another lipolytic enzyme. But this enzyme can only digest emulsified fat, not any other fat. Those fat which are emulsified, that for example, emulsified fat you will find in milk. Can you see the fat? It's floating. No. So it remains in emulsion. So this type of fat can be digested by gastric lipase. Okay. Another secretion is there. Hydrochloric acid is secreted by which cells? This is the lumen of the stomach, and you will find some pores. These are the gastric pit. So this part is gastric pit, this part. And these are the gastric glands. And a single layer of epithelium, there are different glandular cells. Okay. So now what are these cells? Mucus cells. These are the mucus cells. They will produce mucin. And this mucin has got function. What is the function of mucin? This will protect the surface of the stomach from hydrochloric acid. Otherwise there will be erosion, there will be ulceration. So it is prevented by mucin. These are the cells, these are columnar epithelium. So they produce mucus. These cells are called mucus cells. Mostly they are present here. Some mucus cells are also present. These are glandular mucus cells. Okay. And next is Word parietal cells. They secrete hydrochloric acid and intrinsic factor. The intrinsic factor will help in absorption of vitamin B12. Right. So there are other cells that will produce pepsinogen. Okay. These cells are called chief cells or peptic cells. And there are some other cells, these cells, they produce some hormone. And this hormone, what is the name? Gastrin. This hormone controls two functions. Number one, gastric motility, and secondly, the amount of secretion. How much secretion would be there? This are controlled by this local hormone. Okay. So another controlling mechanism is there. That is the neural control. So all this GI tract, this part from stomach to intestine, they are under control of autonomic nervous system. So autonomic means sympathetic and parasympathetic nervous system. When sympathetic nervous system is stimulated, then what happens? There will be retardation in controlling function. Peristalsis will be retarded. Okay, so when you are excited, super excited, there will be activation of sympathetic nervous system, and this will retard your digestion. Okay, by reducing gastric motility, by reducing gastric secretions. Okay, but parasympathetic nervous system has got the opposite effect. Moreover, digestive system has got its own neural control. This is called enteric nervous system, ENS, enteric nervous system. They have different plexuses. One plexus is orbitary plexus, and another is myenteric plexus. The main function of the myenteric plexus is motor, means it will increase the motility, gastric contraction of the muscular cord. So there will be increased peristalsis when these are stimulated. And the other plexus, orbitary plexus, they will cause increased secretion of intestinal and GI tract hormones, and thereby it will control the function. One more important thing is, if you go through from here to here, you will find, when you will be approaching from lumen side to inner side, you will find the alkalinity is gradually decreasing. In the outer side, there will be most alkaline, and gradually it will be becoming less alkaline. What is the purpose? So that hydrochloric acid cannot penetrate inside. So it is one of the function of the anatomical modifications, so that to protect you from hydrochloric acid. These are the layers you know already. What is the function of mucus? Protection from hydrochloric acid. Beside this, it's slippery, no? Mucus is slippery, so it will allow easy passage. Trouble of the food from downward direction, means from stomach to intestine, from intestine to large intestine, this way. The serous coat, the outermost coat, what is its function? Protection from external, from outside it is protecting the stomach or GI tract. So it is the protection from external protection. Okay, and there is peritoneal cavity, forget it. Duodenum. From stomach, duodenum starts. It is almost C-shaped. How much? What is the length? About 25 centimeter is its length, and it is under sympathetic and parasympathetic control. You will find, if you take a section of duodenum, it will look like this. You see what are these? Finger-like projections. What are these? V-I-L-I. What is this? Villi. So, okay, these are the villi, and you see, these are lined by epithelial cells. Simple, these are simple columnar epithelium, and they will secrete mucin. And not only this, here you will find some glands, intestinal glands. We know the secretion of, there is secretion of juice, digestive juice from the wall of the intestine. What is this juice called? Intestinal juice or juice of succus entericus. Succus entericus. So they will be having digestive juices. Proteolytic, carbohydrate splitting, as well as lipolytic. So we'll see in details later. See, what are these? Circular tubal structures. These are actually elongated. So when you take, a ring-like structure you will get in the section. So these are Brunner's gland. These are Brunner's gland. And outside this, there is circular muscle layer, and accessory to this, there is longitudinal muscle layer. So we know the functions of longitudinal fiber, muscle fiber, smooth muscle. These are all smooth muscles. Okay, and these smooth muscles, contraction of smooth muscles will produce some movements in the GI tract, and pendular movement, peristaltic movement, there are other movements. So gastric motility will, in one class only, will study different type of movements. What is the function of this? What they do? Alkaline fluid. They secrete alkaline fluid to protect the lining of the duodenum from stomach acid, that is hydrochloric acid, that is entering from stomach. Brunner's gland secrete an alkaline fluid that contains mucin to neutralize acids coming from stomach. Besides, it secretes remember this thing, enterogastrone, a local hormone. Enterogastrone, a hormone that inhibits the secretion of gastric acid. So they will sense how much acid is coming from stomach, entering from stomach into this. They will not allow. So when we feel acidity, when these food are not passing from stomach, lumen of the stomach into the next part. Okay, so only then food will be coming when the acid already present in it, when it will be neutralized, then only it will be passing, the food bolus will be, chyme will be passing to the next part. Otherwise not. Like when it becomes, we suffer acidity, what we see? We feel flatulence, distension of stomach, nausea. So this sort of feeling we get, that means food is not passing. Gastric motility has been reduced. Okay, because of action of these hormones as well as nervous system. Duodenum, you see, what is this? This is the villi, and this is the crypt of liver cord. They will actually secrete the digestive juices. The glands secreting, the cells secreting the different enzymes, they are actually secreted from these cells. From these glands, that is crypt of liver cord. See, round circular bands, ring-like bands round, it will be throughout the length of intestine, you will find this. Okay, and these are histologically, it will look like this. So, why it has been done? Why this modification has been done? To increase the surface area. So, these are the villi, and here you will find some microvilli is there. The cells, epithelial cells are having microvilli. This has increased the surface area. This has increased the surface area. Microvilli also increased surface area further. This is the duodenum, as I said. See, one duct is opening here. Through ampulla of water, these ducts are opening. And this duct, another duct will be entering here, that is the pancreatic duct. Let's see where is this diagram. Here is the liver, left lobe, right lobe, in between intermediate lobe. So, right lobe will produce one bile duct, left lobe will produce one bile duct. They will combine and form a common duct. This is common duct, common hepatic duct. And this duct, while coming down from liver, one branch is produced that connects gallbladder. Here is one sphincter at this junction. This sphincter will not allow passage of fluid into the lumen. This sphincter. When you are not taking any food, so this will be blocked. When you will take food, this will be opened. This will be opened reflexly or by the action of local hormones. So when this will be opened, not open, when it is closed, but liver is continuously producing bile. Now where this bile will go? This bile will pass to the gallbladder. So there is a channel. Through this channel, it will be passing to the gallbladder. Now what the gallbladder will do? It will be distended. It will accumulate bile, and during this process, during the staying there, it will do two things. First, it will absorb water from the bile to make the bile concentrated, and it will add some mucin. It will add some mucin. So, mucin content of gallbladder, one question comes, what is the difference between hepatic bile and gallbladder bile? Actually, this hepatic gallbladder bile coming from the liver. Coming from liver, and here it is storage. So during the storage, some water will be absorbed, so this will be concentrated, water content will be less, and mucin content will be relative. This is the only difference. And you have heard there is formation of gallstone, gallbladder stone, cholelithiasis. Lithia means stone. Cholelithiasis means stone in bile, stone in gallbladder. Okay, so why it is formed? Bile contains cholesterol. It also contains bile salts, and they remain suspended because of the ratio of cholesterol to bile salts. When this ratio is disturbed, bile salts settles down and starts to accumulate and forms stone. So this way actually stone formation started. So you have taken food in the morning, throughout the day you didn't take anything. Again at night you are having time, that time you will be taking food. So there is a long period during which bile remained accumulated in the gallbladder. So you are doing it day after day. As a result, what will happen? Ultimately, there will be gradually formation of this. So you should take your food in a regular fashion, not giving too much of gap, and this will also create more hydrochloric acid secretions. There is no food, even then there will be secretion of hydrochloric acid. So you have to be careful regarding taking food. And purpose of increasing surface area, main purpose is what? Absorption. From carbohydrate what we got? Glucose. Now they can pass through the wall into the blood. Okay? And what will be the product of lipid digestion? Glycerol, triglyceride, then triglyceride will be hydrolyzed into fatty acids, three chains of fatty acids, 3 fatty acids and 1 molecule of glycerol. You will get cholesterol too. There will be digestion of phospholipids. So lipids will be separated from phosphates. Lipid, again this lipid will be broken down into fatty acid and glycerol. There are other alcohols too. Beside this glycerol, there are other alcohols also. So they will also be formed. The pancreas lies here. This is a pancreas lies. The duct opens here. This duct is called pancreatic duct. This duct and the common bile duct, they open into the duodenum through a common aperture, that is ampulla of Batter. There will be one sphincter, as I said. So when at the same time bile and pancreatic juice will enter into the duodenum. What is there in pancreatic juice? A lot of bicarbonate is there. And this bicarbonate will neutralize the acids, number one. Secondly, it is having different proteolytic enzyme, carbohydrate splitting enzyme, lipolytic enzymes. So all these enzymes, one example of this proteolytic enzyme, trypsin. It is secreted as chymotrypsin. Chymotrypsin. So there is another chymotrypsinogen. Trypsinogen, when they will be activated, trypsin will be formed. Chymotrypsinogen will be converted into trypsin. We will study the function of each. These proteins, they are made up of polypeptide chains. These are amino acids. These are different types of amino acids. They are linked together by peptide bonds. There are other polypeptide chains. These polypeptide chains are linked together by different type of bonds, and they will form primary structure, secondary structure, quaternary structure, tertiary structure, different form of structures will be formed. So now the function of this enzyme, proteolytic enzyme, to break these bonds. See, if I break this bond, smaller peptide is formed. Again, there is tripeptidase. This is tripeptide. So they will split one peptide bond. As a result, what will be formed? One amino acid plus dipeptide. Again, when this bond is broken by this, there will be another type of enzyme, dipeptidase. They will break, hydrolyze these bonds. As a result, two amino acids will be formed. So in this way, they digest proteins into amino acids, several amino acids. Now they will be diffused from the lumen into the blood, and will be where this blood will first go, to my heart or to my brain or to muscle or to spleen, or which organ it will enter. From here, from intestine to heart to liver. First, let everything come to me. Then I will decide how much to release into the circulation, how much to keep with me, what is there which needs to be detoxified, to be destroyed, because some foreign bodies may also come through the food. So there are Kupffer cells for protection. Immediately they will capture it and destroy it. Okay, so that's why food initially comes to liver, modifies some vitamins. Liver stores some minerals. So for that purpose it has to come to the liver first. After, small intestinal wall also contain several lymphatic nodules. For example, Peyer's, P-E-Y-E-R apostrophe S, Peyer's patch. These are actually lymph glands. Or we know lymph glands provide us protection. So it is there to protect us. Through food, some injurious substance may enter, some foreign bodies may enter, some bacteria, virus may enter, so they will destroy those through inflammatory reactions. Okay, that's why this is, see the presence of them. How they are, existence of this, because to give, through digestive system, to give protection, they are producing, they are making pair space there. So after small intestine, what is the last part of this small intestine? Ileum. Now the ileum will enter into the large intestine through this junction, ileocolic junction. So below this junction, what is this? Appendix. Near wood 8 centimeter long, and often it becomes inflamed. When it is inflamed, severe sensation, severe pain you will experience, severe pain, intolerable pain in lower abdomen. And at the same time there will be fever. There will be nausea, vomiting. So it is diagnosed, immediately it will be diagnosed through these sign symptoms. It is appendicitis. If it bursts, because see, there are lot of blood, nerve supplies here. Because the presence of this nerve supply, they produce pain sensation. But for that purpose, for this reason, we face a lot of pain. Okay, so when it is ruptured, huge, profuse bleeding will be there, and the patient may die within hours. So, what has to be done? Immediately, this has to be removed. Okay. We had two such organs. There is no function, even they are present. What are these? Vestibular organ. Another?
Sir, I need to give him a break.
Colon. What are the functions of colon? Ascending, transverse, descending, sigmoid. So what are the functions of this? Absorption of water, minerals, and formation of stool, fecal matter. And this fecal matter should hold some amount of water. When all the water is absorbed, the stool become very solid. So it will be very difficult in defecation. We call it constipation. When you should take to remove or to prevent constipation, what you should do? First of all, sufficient water you have to drink. Then, you have to take lot of fibers. They benefit in different way. Fibers lowers cholesterol level. Fibers prevents colonic cancer. Fibers prevent sudden rise of blood glucose level, sudden shoot of blood glucose level, because fibers slows down the absorption of glucose. Therefore, there will not be shooting. Shooting is one of the main problem. Sudden rise after eating food, there will be sudden rise of blood sugar level. And in diabetic patient, normally we will bring it down by the action of insulin within 2 hours. Within 2 hours, it will come down to normal. But in diabetic patients, since insulin is not there, it will remain in blood and it will coming down. It will take more than 3 hours, 4 hours, 5 hours, 6 hours. So as a result, what will be? Blood sugar will remain raised. And that is the problem. You will feel hungry, but your blood is having a lot of sugar. Since it cannot come into the cells, come into the muscles, you will feel weak. So that's why what you have to, either you have to take externally, you have to take insulin, or you have to take some drugs that will facilitate entry of glucose into the cell. In diabetic patient, so either they are taking oral drugs or insulin. Another important function of large intestine is, anybody? We haven't discussed. Another important function of large intestine. When we give probiotics, why we give probiotics? Why we give, I will prescribe vitamins along with antibiotics. Why?
Because when we take antibiotic, there is in the our gut there is good bacteria and bad bacteria. Good bacteria like Escherichia coli.
All bacteria will be killed.
So we want to, if we get the benefit of the good bacteria, we have to.
We will not get the benefit of the good bacteria. So what is the benefit of this good bacteria?
Vitamin B12 secretion.
B secretion.
B12. It's not secretion, not
Secretion means loss.
no, secretion.
Absorption.
Yes, absorption. That's the right word.
Actually, these vitamins, some vitamins will be formed here by this. That's why we will be benefited during antibiotic treatment. If any vitamin is not given, so there will be we will be suffering deficiency of these vitamins. So that's why you give vitamins, additional vitamins. So there is a bacterial flora. And these are also essential for producing some chemicals that protect epithelium of the colon and thereby prevents colonic cancer. Absorbing water and nutrients, function of the colon, producing and absorbing vitamins, compacting fecal matter by absorbing water, and moving waste means fecal matter towards the rectum, and secretion of potassium and chloride. So these are the main functions of the colon. Rectum and its temporary storage. There are two sphincters. One opens automatically when the pressure is increased, and another outermost it is under our voluntary control. You are feeling urge. Internal sphincter is open, but outer sphincter is not open. Biguity is under control. You will find space where I can go for defecation. Then only it will be released. Okay. So these are the functions of rectum and anus. Okay. Oh, that is the picture. Gallbladder. These are the bile ducts. Yellow one. So they are coming, joining this cystic duct. This is called cystic duct, and this is common bile duct. Often sonography says some patient is feeling pain, lot of pain, and at the same time nausea, vomiting. And you know why there is pain? Because some stone slipped from here and entered into the common bile duct. Now the size of this stone is more than the diameter of the bile duct. So bile cannot pass through. But my reflex is trying to pass it. How? It will generate contraction on the gallbladder wall. So that bile will be pushing, but it is unable to come. So there will be pain sensation, lot of pain sensation. Then immediately surgery has to be made, open surgery. So surgeon will push. When this is obstructed, no, these will be dilated. Sonographically it can be seen. There is hepatobiliary dilatation of bile ducts. Means somewhere it is obstructed in, means either in the near the ampulla of bladder. When it is obstructed at the ampulla bladder, there is again it is a life-threatening condition. Because pancreatic juice also will not be coming, will not be entering. So what will happen? Pancreatic juice will start digesting itself. If it is liberated from the canal, from the channel, pancreatic duct to outside, immediately it will start digesting itself. Not only itself, other tissues. Because there are proteolytic enzymes. These proteolytic enzymes will nearby. So as a result, what blood vessels will be ruptured, will be damaged. So there will be profuse bleeding. The patient will die within short period of time. So pancreatitis, this is called pancreatitis. Two, obstructive pancreatitis, and another one is infective pancreatitis. So both are life-threatening. Okay. So if there is any obstruction of calculus here, so surgeon from the back pushes and ultimately it will enter into the lumen of the duodenum. Or else, one catheter will be sending to the ampulla bladder, then it will regulate to it, drive it to the common bile duct, it will basket it, take it out. Okay, nowadays these are done. No laparotomy is done. Function of gallbladder I said. Oh, I was looking for this only. Pancreas is called, it is both endocrine as well as exocrine. Digestion is related to exocrine function of pancreas. So what it will liberate pancreatic juice. If you take a section of histological section of pancreas, you will find a lot of echinus. Echinus means structure, tubular structures. If you cut my finger, it is elongated, no? If you cut my finger, a ring-like structure you will find. So this type of elongated structures you will get. These are echinus. So surrounding cells are producing enzymes and they are liberated into the canal. Now this canal joins together and will be forming pancreatic duct which will enter into the duodenum. So it is a ductal system. Duct is there. Duct is there. What it has formed, this will pass through a duct. But for endocrine function, there is no such duct. Exocrine glands are having ducts, but endocrine glands are ductless. They will secrete their secretion directly into the blood, into the extracellular fluid. From extracellular fluid, it will enter into the capillary. There is no duct for that. So pancreas is having both. In islets of Langerhans, you will find alpha cell, beta cells and gamma cells. They will produce insulin, beta cells will produce insulin, alpha cell will produce glucagon and the other cell will produce somatostatin. Okay, so that's all today.